Good afternoon, and welcome to today's webinar on GetWellNetwork's Veteran Ambulatory Experience. My name is Bethany Christensen. I'm with GetWellNetwork, and I'll be the operator on this call. Before we begin, I want to take you through how to use the GoToWebinar platform. All attendees are in listen-only mode. If you would like to ask a question, simply type it in the question box in your navigation pane. You can ask a question at any time during the webinar, and we'll address them at the end of this call. It's now my pleasure to turn things over to my colleagues, Christy Grau, Chief Nursing Officer and VP of Government Client Services, and Carl Morneau, Director of our Government Client Services team.
Thank you, Bethany. Good afternoon, everyone. The purpose of this webinar is to support optimal use of GetWellNetwork tools and resources to drive targeted performance improvement. On our agenda today, I will be giving an overview of GetWell's government outpatient solution, and then we'll pass it over to Carl, who will then be giving a demonstration of our primary care version of the government ambulatory experience. The objectives in today's webinar are to learn about health education content that is available on tablets that will help educate and engage veterans to help them make informed decisions about their care plan, to learn about how to add video education into current patient education teaching programs in VA community-based outpatient and specialty clinics, and to learn how to support optimal use of GetWell government ambulatory experience tools to help workflow efficiencies and improve staff and veteran satisfaction. Let's get started. The GetWellNetwork Veteran Ambulatory Experience was built with the input and feedback from VA PACT or patient-aligned care teams, specifically to meet the needs for the VA's community-based outpatient clinics and specialty clinics. The purpose was to provide a solution that will help to amplify and improve the impact of an outpatient clinic's current patient education efforts. We initially worked with the VA Phoenix Southeast CBOC. Their goal was to supplement and enhance the patient education printed material that the teams were already using for common primary care diagnoses and be able to easily identify videos that would be appropriate for patients, either a new diagnosis or for a patient that has been managing a chronic illness. They wanted the ability to standardize the patient education content to ensure a reproducible, consistent delivery to their patient populations. And they also wanted to equip their patients with the skills and behaviors for self-management by educating them on diagnosis, medications, and their prescribed treatment plans. The Veteran Ambulatory Experience is patient-centered. Veterans will have the education and support they need to make the decision and participate in their own care. The education content is comprehensive and resources are readily available to the veteran. Maybe they came into the clinic due to knee or hip pain, but over time, because of decreased mobility and pain, they have become depressed. They are able to easily access the content about depression to help them explore another area of comorbidity that they may not have mentioned to their primary care provider. They will be able to access the content on their own, and it may encourage them to reach out for help if they have not already. If you're familiar with the GetWellNetwork's inpatient experience, this solution is very similar, with priority and favorite spaces that are intuitive to the staff, the veteran, and their family to navigate. There is a video education on the tablet, prompts that engage the patient to complete education, and also Rounds Plus that enables the veteran to give feedback on the care they received during their clinic visit. Key features include a full patient education video library curated to meet specific clinic needs with Milner Fenwick Health Clips, Swarm, and also Staywell as the content providers. The Lexicomp medication database is available for the veteran to look up a medication prescribed to them. A smoking cessation curriculum is included within a priority space which has been developed to match the VA-produced smoking cessation patient education workbook. The GetWellNetwork diagnosis-specific pathways are also included. For example, diabetes, CHF new and existing diagnosis, which would be applicable in the outpatient setting. For the patient, the GetWell Rounds Plus survey technology can be accessed within a priority or favorite space. This can be used for patient satisfaction assessments, accessible to the veteran to complete after the clinic visit. The solution also comes with Rounds Plus license, so the leadership and staff will be able to use the application for WeCare rounding, employee satisfaction, or any quality or safety audit like environment of care rounding, Joint Commission readiness assessments, or hand hygiene compliance data collection. The solution is effective to help with wait time management, as a veteran may be waiting to be seen by their provider or after their appointment if they are waiting for VA-provided transportation to their home. The goal is to maximize the brief time when a veteran is in your clinic to provide them with education personalized to their specific needs. It is an opportunity to improve the veteran's understanding of their current diagnosis and treatment plan to include medication teaching. The VA healthcare delivery system is a frequent topic reported on in the media, and there is constant evaluation on how the care is delivered and if it is improving veteran population health efforts. By deploying a scalable, robust patient education program is central to elevating patient engagement and ultimately serves as a cornerstone of a winning population health management strategy. In order to independently manage their acute or chronic conditions, patients need to learn new skills and behaviors. Activated veterans are an essential driver for a population health strategy. This is a technology tool to help support that for both the clinician and the veteran and their family. The veteran ambulatory experience impacts the VA Medical Center's top priority health issues. The solution configuration and content organization has a focus on the chronic health conditions of diabetes and heart failure, weight management and exercise, tobacco cessation, women's health topics, and behavioral health topics of depression, PTSD, managing stress and addiction, alcohol and substance abuse. The software and video content also includes a focus on the ambulatory care sensitive conditions measured in the SAIL report by the number of preventable hospitalizations, specifically the chronic conditions of hypertension, CHF, asthma, pneumonia, COPD, and diabetes. In theory, for this measure, with adequate access to primary care and treatment, including essential health management education, will help to activate and engage patients to decrease preventable hospitalizations. As a provider in a clinic trying to manage a panel of patients, there are a lot of pressures to do more with less, time, staff, to see more patients, etc. And to improve the clinical outcomes of your patients, you manage all within 20-minute appointments. Healthcare teams are not miracle workers. Finding time to educate patients can be tough in busy clinics. It can also be exhausting. If you are trying to teach the same content over and over again to different patients throughout the day, your morning clinic patients may get a little better explanation of what an asthma action plan is, vice your last patient of the day. This tool will help extend the team's expertise, standardize the delivery, and improve their efficiency to help patients improve their care. The goal is to improve patient safety and quality care. We anticipate decreases and improvement in all of the related outpatient SAIL report measures, decrease in ambulatory sensitive condition hospitalization, decreases in all-cause and disease-specific readmissions, improve HEDIS outpatient performance measures, and improve patient-centered medical home survey scores. The Veteran Ambulatory Experience will also comply with Joint Commission or NCQA, the National Committee for Quality Assurance, patient-centered home medical recognition standards for patient and family education. Also will help with clinic operational support by utilizing the Rounds Plus technology. This solution can be designed to meet specific clinic education topic requirements, depending on clinic type. A CBOC or primary care clinic, same-day surgery center, GI procedure clinic, or any other type of specialty clinic to meet the veteran's education needs. Utilizing the priority space Tell Us About Your Clinic experience, the veteran is able to give feedback directly to the clinic staff. This type of patient feedback could be drilled down to provider, and any questions can be easily customized and changed by the clinic staff. They do not have to wait for our team to make any changes or to produce any reports. The results could go directly to any designated care team. The clinic will also have the license again to use the Rounds Plus performance management system to help support clinic operations like environmental care rounds, We Care leadership rounds, and staff satisfaction surveys. Any data collection that is currently occurring in the outpatient setting could be captured utilizing Rounds Plus. So We'll pass it over to Carl, who's going to provide a solution demonstration.
All right, thank you very much, Christy. So before I get into the live demo, I'm going to just show you the really quick check-in process. Because just like for those of you who are familiar with our inpatient product, in order to personalize this for each veteran, we want to be able to check in a patient to that particular veteran. So basically, what you're seeing over on the left-hand side is what you would see, your staff would see on the iPad. So they would have the hello screen. They click the start check-in here. They would put in the patient's first name. They would choose the language, whether it be Spanish or English. And then once they do that, then the staff will have the ability to actually prescribe education order sets based on the patient's diagnosis at check-in or based off their chief complaint for their clinic visit. So each of these order sets that you see on the screen are comprised of 3 to 5 videos grouped by health education topics. And just like with our inpatient experience, these videos, they are health clips. So they're typically 3 to 5 minutes long and, to help promote the utilization from the veteran. And then the patients are also able to go in and browse, the entire education library at their leisure once they complete their assigned education. So let's go ahead and move over to the live demo. So what you're seeing here is actually my iPad. And so for those of you all who are familiar with the inpatient experience, like Christy had mentioned earlier, you can see this is very much similar to the layout of the GetWellNetwork inpatient experience. Starting in the upper left-hand corner, you can see we have, the general salutation, hello, Carl. And then over on the right-hand side, we got the date and time. We still have the action plan, which is comprised of the 3 priority spaces, just like you would see on the inpatient side. And then down at the bottom, we have the carousel, which consists of 15 favorite spaces, just like the inpatient experience. We still have the My To-Do list available on there for any assigned education or any assigned pathways for the veteran to complete. So starting off, if you're familiar with our inpatient product, you should be very familiar with this first priority space, which is the Watch Videos Pick Just For Me priority space. So these are where those videos are going to sit that you had prescribed for that individual patient during the check-in process. So the example that I'm showing here is our angina order set. So as you can see, there's 5 videos, each of them, roughly about 2.5 minutes long. And these are designed for the veteran to watch, while they're sitting in the waiting room waiting to be called back for their appointment. The second priority space is the Tell Us About Your Clinic Experience. And so this is where we would actually link the ambulatory experience to our Rounds Plus platform to allow you to have any type of questionnaire that you want to have available. For this particular clinic at the Hamilton CBOC, which is part of the New Jersey healthcare system, they wanted to have their outpatient veteran experience survey built underneath this. And so every single veteran that has the opportunity to utilize the ambulatory product is going to be encouraged to complete a survey before exiting for the day. And then the third priority space over there, which rotates out, just like it does for our inpatient experience, this is where veterans can actually click and they have access to our entire education library if they choose to search videos on their own. And if you notice, when I go back to the home screen, these priority spaces rotate out. So the next one that would pop into place would be Learn About My Medicines. And so if a veteran goes in here and wants to watch videos around medication safety, or they could actually search for a particular medicine if they're looking for a particular medicine to learn more about. And then we go back to the home screen. As you can see, it rotates out. The next one is Learn Why It's Important to Quit, and this is our smoking cessation pathway that's available for all of the veterans through the ambulatory experience. And as you can see, it refreshes and it keeps rotating through. Now these priority spaces, during the implementation phase of ambulatory, if you choose to go with this product, you will sit down with the client services team, and I'll talk a little bit more about this at the end of the demo. But basically, these are where your focus areas are going to live within this experience. So for instance, if you want to just focus on those ambulatory sensitive conditions, then we can have those pathways up here on this priority space carousel for the veterans, so it's up front and center for the veterans to complete before their appointment. All right, so moving down to the bottom, to the favorite space carousel, like I had mentioned earlier, there's 15 of these favorite spaces available. The first one on the left is your clinic and your care team and clinic. This gives you the opportunity to actually put information on the iPad, particular to your outpatient, community-based outpatient clinic. So for instance, the Hamilton CBOC decided that they wanted to have their hours of operation and their phone numbers. They wanted to know, they wanted to allow the veteran information around the special features, information around their primary care teams, any specialty clinics that are available within that CBOC, and then how to book appointments for that CBOC. And again, this is completely customizable during your implementation process. And then the next two options, just they wanted to have something on here to help differentiate the difference between cold and flu. And so we have, some definitions on here for the veterans to go ahead and read through while they're waiting to be seen. And then there's a link to an important video from the Joint Commission around speaking up, at the doctor's office, and the importance of, being able to communicate effectively with your care team so that way they can provide you with the best possible care. The next favorite space down on the favorites carousel is learn about your medical conditions. What we have done here is we have actually taken the whole entire education library of over 400 plus videos, and we've grouped them into categories to make it really easy for the veteran to be able to find that specific video that they're looking for. So they don't have to scroll through the entire library. They can look on here. So for instance, if they're in for a COPD follow-up, then they can click on the COPD category, and it'll have all of the COPD videos that are currently available in the library. The next tile is it's the same tile as we have up for the priority space. It's a learn about medications. So a veteran could click on the learn about medications favorite space. It'll bring them up our entire education library that we have for medication videos, and also the ability to search again for that particular medicine that they're looking for. So for demo purposes, I'm going to show you, we're going to type in here Tylenol. Hit search, and then we're going to give them the data sheet explaining to the veteran why that medicine was prescribed, what its side effects are, what special precautions, and then any other information that's available for that particular medication. Another cool feature is the ability for the veteran to send this information to their personal email address if they choose to do so. So by clicking the little envelope icon in the upper right-hand corner, they can type in their email address, hit continue, and then what it will do is it will send a hard copy of this information to their personal email address. The next category that we have on the favorite space is healthy living. Underneath the healthy living category, this is where you're going to see a lot of your whole health content. So we have behavioral health videos available, videos around promoting physical activity, nutrition, how to deal with stress, obesity and overweight, knowing how to take your vital signs. And the next category is around managing your pain. Underneath this category, we have several videos available around what exactly is pain, how to describe your pain, what pain management options are available, and then we go into some really specific disease-focused videos around RPS and fibromyalgia and lower back pain. So let's hit the carousel and go to the next 5 topics. These are going to be more your sensitive condition content. So the first one we're going to look at is going to be learn about diabetes. We click on that, and here is where you'll see all of the videos pertaining to, a patient that would be diagnosed with diabetes. Learn about your heart. This is actually a really cool favorite space here. And what we've done here is we've taken all of our videos that have to do with the heart, and we've grouped them into several categories. Specific to congestive heart failure, specific to stroke, hypertension, coronary artery disease, cardiac rehab, high cholesterol, and we also have some videos to teach veterans about the different arrhythmias they could potentially come across. Underneath our behavioral health topic, we have several video categories here. Videos around depression, recovery. Again, we have stress videos and how to deal with stress, and then we have some videos around PTSD. We have another category, drinking and substance abuse. And underneath this category, we have videos from a website called Make the Connection, which helps veterans, these videos are veterans talking about their battle and their journey with specific, addictions, whether it be alcohol or substance abuse. And so this gives the ability for the veterans to actually listen to another veteran's story about how they dealt with those conditions. And then women's health. We have a favorite space for women's health. And so underneath this, we have different categories that will pertain particularly to women's health, whether it be urology conditions, heart disease in women, cancer, and OBGYN symptoms and conditions. And then the last part of the carousel, we have some other additional topics around orthopedics. So any musculoskeletal conditions, back, neck, or spine conditions, osteoarthritis, mobility devices, fractures and sprains, joint replacements, and then rheumatoid arthritis. And we have a favorite space for cancer. We have categories around the different types of cancer, and then we have some video content around cancer diagnosis and treatment. And this is just an example of some of those videos. Medical tests and procedures. We have several content around different laboratory tests, different radiology tests. So if a veteran wants to know why they're taking their blood, they can click on here and see what a CBC is, what a complete blood count is, and what it pertains. Vaccine and immunizations. We have several videos around the flu vaccine, cancer vaccines, the hepatitis A, hepatitis B, the pneumococcal vaccine, MMR, influenza, and these, put these really at the fingertips of the veterans, especially as we're approaching the flu season. This is going to become more important. And then finally, the last favorite space that we have is our veteran resources. And this is where the veteran can go in, and this can be customized, per facility on what you want to have underneath this. So basically underneath this tab for the Hamilton Clinic, we have a link to different PTSD resources. We have a link to the Veteran Crisis Line, VA telehealth services, the Smoke-Free Vet to help promote smoking cessation, and then the link to My Healthy Vet to allow the veteran to be able to actually log into their My Healthy Vet account, while they're at the clinic, so that the clinic staff there can work with the veteran and, help promote that website. So that pretty much concludes the live demonstration. What I'd like to do now is, let me get back to the slide presentation, is to talk a little bit about the implementation process. So this is an overview of our client services implementation plan. At the beginning, we're going to work with your team to understand what's your current process, and together we're going to come up with a plan that will work for each individual clinic. Collaboratively, we're going to establish outcome focus areas. Some examples of those might be, utilization of the education completion, maybe improved patient satisfaction or improvement in sale measures. Our team is then going to map a patient workflow and staff workflow through the clinic to strategize on the best practice on utilizing the tablets as part of the patient's clinic visit. We'll then also identify any video content appropriate to match those top diagnoses seen at the end clinic type. We will then add the Rounds Plus patient satisfaction assessment questions agreed upon by the healthcare team, and finally configure the solutions and plan staff training prior to an established agreed upon go-live date. We're also going to provide support in monitoring and measuring utilization of the solution and track any outcomes associated with the technology. The cool thing about this product is if you currently have the management console access on your workstation, you're going to be able to track in real time, your education utilization, through the management console. And then those cool features underneath the My Patients tab that I know a lot of the clinicians enjoy with the inpatient experience, they can utilize those as well with the veteran ambulatory experience. A really great example is the messaging feature. To be able to send a text message to that patient that you know that has that particular iPad, to send that real time to them, to let them know maybe, you know, if the provider's running a little late, or, you know, maybe you want them to run to the lab, you know, before they come back for their appointment. Just a couple of examples. And then the question on everybody's mind, I'm pretty sure, is this integrated? So let's talk about the current interface capabilities that we currently have with our inpatient product and what we're looking at for our ambulatory product. So basically, with our inpatient product, we're interfacing with the veteran CPRS chart. The way we're doing that is through what's called the ADT HL7 message, which we're receiving from Vista. And what that does is it tells us who the patient is and allows us to assign that particular patient to a GetWellNetwork location. Now, with outpatient visits, they unfortunately, they do solicit HL7 messages, but they more utilize the SIU message. And so in its current state right now, the veteran ambulatory experience is not able to solicit those messages, but we do have it on the roadmap for the future. So, for instance, if a patient gets assigned to a particular dialysis bed, or if they get assigned to a particular chemo bed, then we would be able to solicit that SIU message and assign that patient through Vista to that particular location, and then all of the interface capabilities that you would see with the inpatient experience will be available on the ambulatory experience, such as automatic documentation of that education completion back into the patient's charts. Another question that comes up around device management. And what I have on the screen here are just a couple of examples that are available out there. These are, just off-the-shelf products that, as we roll this out at various CBOCs, there's always the worry about theft. And, they're worried about the iPads walking out of the clinic. And so during the implementation process, we're going to share some of these other options that are available. Like, for instance, the stand on the left-hand side that you see there, which allows us to mount the iPad to the stand, which makes it a little bit more difficult for the veteran to walk out of the clinic, with an iPad.
Great, Christy and Carl, thank you. At this time, we will now take questions. To ask a question, go to the Q&A box on your navigation pane and type it in. Questions will be taken in the order they're received, and if we don't get to yours, please submit it in the post-webinar survey. We'll just follow up with you directly. All right, first question. What are the hardware requirements?
I'll take that one, Christy. So there is a hardware requirement for you to be able to utilize the veteran ambulatory experience. It does require an Apple iPad, and that Apple iPad would need to be mapped to the Verizon secured APN in order for ambulatory to work at your particular location.
Okay. When is this going to be available, and what current clients do you have using the ambulatory solution?
I can take that one. So it is available now. We're live in about 10 clinics down in Texas, and we're currently in the implementation process with the New Jersey healthcare system.
Okay. How many tablets do you recommend that each facility get?
So in general, we say about 3 iPads per provider. Figuring about 20-minute appointments, so you have about 3 at any given time in the system as patients are checking in, or they're in with a patient, or they're in with their provider. And the other thing to consider is if you have other providers that maybe are just coming in, maybe they're not there for the whole day or every day during the week, like nutritionists, dietitians, psychiatrists, pharmacists. We also kind of take into consideration just the workflow that the teams decide upon. Maybe they want to have however many front desk staff that they could have those iPads staged at the front desk to start out, or that's, they'll hand the patient the tablet as to do a checkout survey. But that's one of the things that we discussed with the team during the kind of contracting phase.
How are clinics using the solution and keeping track of the tablets once they're given to the veteran?
So far, a lot of discussion around that particular topic, and a lot of concern that there will be some loss. So they could be signed out. That's probably the easiest way to do it, that there's some accountability with the veteran signing a document that they have the iPads, and it could be checked in and out that way. Like Carl said, with the device management, the rolling stand where it's mobile and it can kind of follow the veteran around the clinic into the different spaces seems to be the most popular. And then also, like the 10 clinics that we have down in Texas, they're not doing anything. They haven't had any issues at all, handing the tablets to veterans, and then they're able to get them back as the staff will take them back as they go into the provider's exam room.
Okay. One more question. Will these be available for use with topics like renal education, and could they be used both in a VA clinic and on a VA dialysis unit?
So yeah, we do have access to the 3 different vendors in terms of right now. I know that pyelonephritis is on there. I'm pretty sure that there is the Milner Fenwick has some kidney failure video content. It's just something that we would source based upon need assessment when we to talk about what would meet that particular need in the clinic, or the if it is a dialysis unit or surgery unit.
Okay, and who needs to order this product, and how do we know what topics are available?
So in terms of,
so you can actually, after the webinar, you'll see a survey. So if you'd like more information or a demo, you can select that. Carl, do you have anything to add?
Yeah, I was going to say, if you're a current GetWellNetwork client and you're interested in this product, then I would reach out to your client service representative, and they can assist you with, pointing you in the right direction to the right POC from GetWellNetwork to initiate those conversations. And if you're not, a GetWellNetwork client, then like Brittany said, there's going to be a slide at the end that'll have and there's some information that you can reach out to set up a time for a more intimate demo.
Okay. And with that, thank you for your questions, everyone. If we didn't get to it in this webinar, we do have it, and we will follow up with you directly. At the end of the webinar, you'll see a survey pop up on your screen. It takes just a minute to complete, and we really appreciate the feedback. Additionally, we'll be following up with you to provide the slides and a link to the webinar recording. And this concludes today's webinar. Thank you, everyone, and have a great day.